Hi friends, today we are going to be looking at medicine 2023 November December one word section. Thank you so much for following us. This is Academia Zambia. Continue sharing our page in all platforms. Thank you so much. Let's start. 71. The question says the process of red blood cell production is called. The answer is hematopoiesis, which is the process by which the body produces blood cells, including red blood cells, white blood cells, and platelets. It actually occurs primarily in the bone marrow, so don't forget that. Then 72, the question reads, resistance to flexion of the neck due to the meningeal or due to meningeal irritation is called rigidity, which is a medical sign characterized by stiffness in the neck, making it difficult to flex the neck forward. So it is often associated with meningeal irritation, which is inflammation of the meninges. Meninges are coverings, or rather these are membranes that covers the brain and as well as the spinal cord. Okay, 73. The question says a disease in which white blood cells are not properly formed and start increasing in the number in a malignant way is known as what? That is called leukemia. Leukemia is a type of cancer that affects the blood and bone marrow, resulting in the uncontrolled production of abnormal white blood cells, and these abnormal cells can crowd out healthy blood cells, impairing the body's ability to fight infections and transport oxygen. Okay, let's move on. 74. A condition in which there is failure of the small intestines to absorb the products of digestion is called malabsorption, which is a condition where the small intestine cannot properly absorb nutrients from food, leading to deficiencies especially in essential vitamins, minerals, and other substances. So this can be caused by various factors, including celiac diseases, disease, inflammatory bowel disease, and pancreatic insufficiency, and so on. Okay, 75. The question says a chronic non-specific inflammatory bowel disorder of unknown origin that can affect any part of the gastrointestinal tract is called Crohn's disease, which falls under IBD, also called inflammatory bowel diseases, which is a group of conditions that cause inflammation in the digestive tract. There are actually two main types of IBD, which is Crohn's disease itself and ulcerative colitis. Are we there? Give me your minds, friends. Let's move on. 76. A coagulation conditions that occurs as a result of deficiency of anti-hemophilic factor and also Christmas factor is called what? That is hemophilia. That is hemophilia, which is a genetic bleeding disorder that impairs the body's ability to clot blood. So it is caused by deficiency in specific clotting factors such as the factor VIII and also factor VIX, which has their other names as anti-hemophilic factor and also Christmas factor. Okay, 77. A grayish blue or ashen gray color on nail beds seen on physical examination is an indication of what? That is cyanosis. Okay, cyanosis is a bluish discoloration of the skin or mucous membranes, caused by lack of oxygen in blood, and is often seen in nail beds, lips, and tongue. All right, are we there? 78. The question says a term referring to coughing up blood is called, okay, it is called what? Okay, it is called what? That is called hemoptysis. So hemoptysis refers to as the medical term of coughing up blood from the lungs, airways. It can be a symptom of various conditions including bronchitis, pneumonia, and lung cancer. Right? Then 79, inflammation of pleura is called what? That is called pleurosis. Okay, the pleuris. So the pleura is a thin double-layered membrane that surrounds the lungs, and the pleurisy is an inflammation of the pleura which can cause chest pain, shortness of breath, and dry cough with that. Now 80, the question reads, accumulation of pus within the pleural space is called empyema. Okay, empyema. So empyema is a collection of pus in the pleural space, the area between the lungs and the chest wall. It is usually caused by bacterial infection. That is what we must all the time realize. Okay, let's move on. 79, inflammation of the, okay, we did that, so we are getting to 81, I guess. Is it? Yes, 81. So here we go. The infection that occurs when the host has a lowered immunity are known as what? Lowered immunity. That is called opportunistic infections. Okay, then 82. Okay, so 82, the question says trypanosomes are transmitted by these are transmitted by flies. So we all know that trypanosomes are protozoan parasites that cause diseases such as African trypanosomiasis, which is also sleeping sickness, and the Kagaz disease. Now, they are transmitted to humans through a bite of an infected flies. Okay. Now, 83, the question says the common drug used in the treatment of herpes zoster or herpes zoster is what? This is going to be called, okay, so it is going to be called acyclovir. Okay, the acyclovir. Now, this particular drug, okay, it is used in the herpes zoster, also known as shingles. It is a viral infection that causes a painful rash, and therefore acyclovir is an antiviral medication commonly used to treat herpes zoster, and can help shorten the duration of the illness and reduce the risk of complications, which is very, very important respectively in that way. Then 84, the question says COVID-19 is caused by a virus known as what? That is SARS-CoV-2. Okay, listen carefully there. Actually, let me write it because this is written as SARS. We all know SARS. Then it's SARS. Let me just try to write it. SARS. Okay, this is ARA. Then S, SARS, then CoV. We are going to have CoV here, which is CO, CoV, then 2. Yes, this is the name of the virus. So COVID-19 is caused by a virus known as this is the name of the virus, SARS-CoV-2. Right? Then 85 says a chronic liver disease characterized by diffuse inflammation and fibrosis resulting in drastic structural changes and significant loss of function is known as that is called cirrhosis. And cirrhosis is a late stage liver disease in which healthy liver tissue is replaced by scar tissue, and this can lead to a variety of complications including liver failure. All right, so 86 says the intensity of pain can be assessed using a That is pain scale, isn't it? So pain scales are tools used to measure the intensity of severity of pain. They typically use numericals rating usual analog scales or facial expressions to help patients communicate their pain level to health care providers. Others, they may run from 0 up to 10, where the numbers, when they increase, that is the severity of the pain. All right. 87, the question says pain on swallowing is known as what? Pain on swallowing, that is called odynophagia, which is the medical term for pain when swallowing. It can be caused by various conditions including infections, inflammations, and cancer. All right, the causative organism for cholera is known as Vibrio cholerae, which is a bacterium that causes cholera and a severe diarrheal disease that can lead to dehydration and death if left untreated. So it's important that these are taken note of that. So in an exam you find that the same questions may come, so it is important that we take note of what is being explained. Then 89, okay, 89, the question says dash is used to determine the correct type of analgesia. Okay, the question there says dash is used to determine the correct type of analgesia to administer to patients. Right, so I can't see the question properly. I'm sure it could have been read as the dash is used to determine the correct type of analgesia to administer to patients in pain. I don't know if that is correct. You can correct it, guys, for me if you've got the actual paper. Right, so therefore the answer is going to be pain assessment. Pain assessment is actually crucial for selecting the appropriate pain medication and dosage. It involves gathering information about the nature, location, and intensity and the duration of the pain, as well as the patient's pain tolerance and the goals for pain management. So that is pain assessment. The organism that is implicated in cryptococcal meningitis is called Cryptococcus, okay, neoformans in a fungus, and this is just a fungus that can cause cryptococcal meningitis, a serious infection of the brain and spinal cord. It is particularly prevalent in people with weakened immune systems, mostly. Then 91, the process of restoring a disabled gland to the highest levels of functioning possible, that is, what do we call it? That is called rehabilitation, isn't it? So rehabilitation is a multidisciplinary process that helps individuals with disabilities to achieve their maximum level of function and independence. So it may involve physical therapy, occupational therapy, speech therapy, and other interventions, and so on and so forth. Okay, give me your minds. Okay, we go to 92. The formation of a clot in the deep veins is termed as, that is called DVT, deep vein thrombosis. It is a condition in which a blood clot forms in a deep vein, usually in the legs. It can be a serious condition as the clot can dislodge and travel to the lungs, causing pulmonary embolism. Okay, then 93, or rather 93, sorry, a technique used to directly visualize the mucosal lining of the esophagus, stomach, and duodenum is called what? That is 93. That is going to be endoscopy. Okay, endoscopy. The endoscopy. Okay, let's move on. let's move on. Let's get to 94. Okay, probably I can't see this side, so I don't know how you're going to do it. Okay, let's read. And okay, hay fever. Okay, the question says hay fever, which is an inflammation of the nasal mucosa, is caused by, okay, that is allergens. That is allergens. You can also call them as pollens, allergens or pollens. So hay fever, also known as allergic rhinitis, is an allergic reaction to allergens such as pollen, mold, dust, mites, and pet dander. So these allergens trigger the immune system to produce antibodies and antibodies that causes inflammation in the nasal passages. Okay, now this question 95, it's the one that is a bit cut this side, so I can't see it properly. Okay, let's just read. Dash refers to thin, brittle, dry nails which are described as, I'm sure that could be spoon. Okay, that is, I'm sure that could be spoon shaped. Okay, that is going to be called koilonychia. Koilonychia refers to thin, brittle, dry nails which are described as spoon-shaped, and it is a nail condition characterized by concave nails that resemble spoons. So it can be a symptom of iron deficiency, anemia, and other underlying medical conditions. Yeah, okay. I believe, friends, you can, if you have the past paper, please, you can help me see if there is any cut of words on the, especially on the edges. All right, let's move on. Okay, 96. The causative organism for hemobiasis is called the Hematoiba histolytica, which is a protozoan parasite that causes hemobiasis, a disease that can affect the intestines and other organs. So it is transmitted through contaminated food or rather water. 97. An instrument that is used to determine the degree of flexion or extension of the dash joint. If there is a word there, you can tell me. So an instrument that is used to determine the degree of flexion or extension of the joint is called gynometer. Gynometer is a device used to measure the range of motion of a joint. It consists of two arms that are connected by a protractor, to say. Then 98, the position in which is suitable for examination of the rectum and vagina is called what? That is called lithotomy. So lithotomy position is a supine position with the hips and knees flexed and the feet placed in stirrups. So it allows for easy access to the rectum and vagina during examination. All right. Then 99 says exposure to an allergy such as pollen or cigarette smoke for the first time triggers the immune system, or rather immune response, to produce immunoglobulins. So that is going to be immunoglobulin. It produces immunoglobulin, as is spelled as LGE. Okay, LGE, I mean this one. L, then G, then E. Okay, immunoglobulin, like that. Exactly. So now, this is an antibody that plays a key role in allergic reactions. So when the body is first exposed to an allergen, it produces, these immunoglobulin antibodies that bind to mast cells and basophils. So subsequent exposure to the allergen triggers the release of histamine and other inflammatory mediators from these cells, so leading to an allergic symptom. Okay, so don't forget that. Then finally 100, the question says abnormal local dilatation of an artery is known as what? That is called the aneurysm. Okay, aneurysm. Now aneurysm is a bulge or ballooning in the wall of an artery. It can occur in any artery in the body, but it is most common in the aorta and the largest artery in the body. So aneurysm can rupture, leading to life-threatening, bleeding. So it is very, very important that these things are taken so seriously and so well. Okay, thank you so much, friends, for your time, and continue following us. Okay, look for more videos on our page, or rather look forward for more videos that we are making, and we are going to be live almost in occasions. So make sure that you don't forget to share our page, and God richly bless you all. Thank you.